Hi friends, I'm TinkeshKaushik, fitness and nutrition consultant and model and actor.
I'm Dr. Kiran from Hyderabad, expert in diabetes, I believe so. So we had been treating many patients for the last around 15 to 20 years, I believe successfully. So today we have a wonderful opportunity to be with TinkeshKaushik, and let's exchange some views, because as a doctor, you guys know, I might be more interested in prescribing the medicines, but diabetes is not just about medicines, it's about appropriate physical exercise that is necessary for the body, good food to the body and the mind. Food can make you happy, peaceful, etc. So let's have today a cool discussion about certain facts.
Yes. So if anyone have diabetes, they will start with first thing physical exercise, like they can go for walking, jogging, cycling, running. It will help them to burn extra calories. If they are overweight or they are underweight, then they need to start properly with their diet and nutrition. It will take care of your body hormones, which will cause for diabetes, right?
Yeah.
Then once you start, it's all your mind game. You need a just first step to take and go with it.
See, India is becoming the diabetes capital, or I should say it's already a diabetes capital.
Yes.
We have around 11 million known diabetics in India, and still a big number of people are there who have already diabetes, but they are not aware of it.
Yeah.
And there are many diabetics who haven't crossed the diabetic range, but they fall under the pre-diabetic.
Right.
See, pre-diabetic are the people who shouldn't turn out tomorrow to become a frank diabetes. See, that is where we need to work out, and I believe your expertise will definitely help these pre-diabetics, especially if their BMI is like 25 to 30 or more. If these people shed off their excess weight, which is anyway unnecessary.
Yes.
So if they shed out their extra weight and their hormones like insulin that comes from the pancreas will be able to do its job and not get exhausted.
Yes.
Insulin is the one that keeps the blood glucose in control, and also many other factors are there. So what would you say for these pre-diabetic people who are at age group of say around 30, who are slightly overweight, and what measures can they take actually to reduce their weight and prevent diabetes?
So specifically to prevent diabetes, they need to start with their annual medical checkup.
Okay, so you're telling my point. That's fine. So to understand whether where they are,
whether
they are a pre-diabetic,
pre or mid or crossed it, so they need annual medical checkup to get out that thing. Then they should consult with specialize in that, like you are specialized in diabetes. So they should consult with doctors how they can control it, or if they are going to cross the line or they are nearby. So consultant is must in that case. Then once they get connected with medical expert, then they will tell them how you can control it. Like as I said earlier, they will suggest exercise and diet and nutrition part, which is most important. So it's about our lifestyle only. That's the reason it causes so many problems in individuals.
You know what? I should accept and admit that being we as a doctors, you know, a patient with a pre-diabetic may come to me. I may tell him, look, my friend, you are just at the border. If your sugar goes up by 20-30 milligrams, you become a frank diabetic. So your job is to see that you first of all don't cross this border and even reduce go back a little bit.
Yeah.
Like if you could reduce 20-30 milligrams lesser, so you don't even come at the pre-diabetic range. So you will be at a non-diabetic range. So what I would tell him, typically for a pre-diabetic fellow, since he doesn't need any meds usually, I would advise him, okay, these are the typical things. You need a low carb diet, low calorie diet, burn your calories
Yes.
adequately so that you can reduce some weight. So your calorie burning per day should be more than the calories you consume. So have a good lifestyle, eat properly, do physical exercise, and meet me after 6 months.
Yes.
So in what way you think my advice is really going to give him a clarity about how he has to live for the next 6 months? Because you know, when we doctors suggest say 100 people this advice, in 2-3 years, 50% of them are coming back with true diabetes ranges. So are they really justified by having a doctor consultation? So what makes me think is, should I have given him a tablet that would prevent him from becoming a pre-diabetic to a diabetic, or I should have given him a more appropriate direction how he should be able to execute the exercise, which exact appropriate diet he should have been following, so that he could have prevented this frank diabetes.
True.
Because he goes home, he thinks, I have met the doctor advised me, I am good to go, and he will 4-5 days follow some little less rice. And then after 10 days, again back to the work. So he needs a continuous advice, motivation, and a confidence, finally encouragement to continue.
Yes.
Because many of the, see, today India is a very growing economical vertical. India is busy, people are busy, which means people are stressed out. So he is going to, you know, sync with them, be more compatible with them in terms of mind, attitude, so that the guy feels comfortable and feels appreciated for whatever he is trying to do. And ultimately his goal is to what? Be in good health.
Be in good health.
In this particular case, he is thinking about preventing diabetes, right? So I believe he needs, apart from an expert doctor advice, he also needs a professional exercise coach and a nutrition coach, I believe. So in what ways you believe your advice will definitely help him to put forward his health goals and achieve, you know, success in terms of health?
So in that case, like doctor advised to do physical exercise and take care of their diet and nutrition part. Then they should consult with fitness consultant and nutrition consultant. They will design their customized workout plan, diet plan as per the doctor advised. And they will set a goal like in 3 months you have to set this much of extra weight, you need to control your diet, how you will control your diet, if you crave for anything, then how you control it. These things will help them to set a goal and achieve that medical, to prevent that diabetes. It will help them.
Okay. So what do you think typically a South Indian diet consists of? So, you know, it is rice usually. If you take a plate, usually 70% is rice, I believe.
Yes.
And some dal.
Yes.
And do you think our Indian foods are having good amount of vegetable salad, good amount of fiber, good amount of, you know, food
green
to
vegetable.
get green vegetables? From where do you get adequate amount of vitamin C, you know, which is a good immune system helping, and proteins? You know, though we are obese in India, it is believed that Indians still consume less protein.
Yes, they are.
So what is your take-home message on proteins? Since you are a good bodybuilder, I just now saw you doing 30 kgs, you know. I can do hardly 15 kgs, but you are doing 30 kgs with single hand. Yeah. So definitely it is the proteins that is helping us, right?
Yes.
Apart from the carbs and glucose.
Yeah. So when it comes to diet, I believe South Indian diet is most healthy if someone consume in right way.
Right way.
Yes,
You said
right
it
way.
right way.
Right way.
Right way is very healthy.
Yes, because South Indian food is mostly fermented, right?
Yeah.
So it will good for your gut health.
Okay.
And when it comes to fiber, there are so many vegetable and food which will help to regulate the gut. And when it comes to protein, protein also you will get in South Indian food. Like mostly people eat non-veg right here.
Now, actually, South India means in Hyderabad we are currently.
Okay.
And the non-veg is, as you rightly said, it is almost like majority. Repeatedly, non-veg is going on. But when you come to Chennai, their majority mostly would be the vegetarian part.
So in that case, they can use soya chunks.
Yeah.
That's the good source of protein.
And dal.
Dal also consists with carbs, but
Yeah.
soya is good protein source.
Okay.
They can make many dishes with soya. Soya roti, soya sabji, many prep are there.
Yes.
If you will Google it, you will find them.
Okay.
And so that will take care of your protein intake through entire day. You can consume
approximately per kilogram body of our weight,
Yes.
we need 1 gram of protein per day.
Yes.
Say if I am like 75 kgs weight, I
That
need
is-
at least 75 grams of protein per day.
That is your minimal requirement for entire day.
Exactly.
If you are doing any physical kind of activity and you are on extreme activities, then it will keep moving.
It will keep moving and it will
Yes.
even double.
Double.
Like you are a bodybuilder. So when you are into bodybuilding, you need more proteins.
Yes, as per my goals, if I want to compete, if I'm in maintenance, then it will keep changing.
Yeah.
From 1 to 2 range, it can be anything as
Okay.
per your demanding goals
Exactly.
and your body requirement.
Okay.
So that will take care. And mostly we consume junk food.
That's the problem.
That's the big issue.
And
In
unfortunately,
today's generation.
the advertisements, the easy availability of the food,
Yes.
the home that is, with the touch of your smartphone screen, you get food delivered to your home.
Yes.
So that is, I guess, one of the biggest, I can't comment on commerce aspects, but regarding the health, it is a very big disadvantage.
It is because nowadays what happened, we eat what we see.
Yeah, and to make you eat, it is being shown to you.
Shown to you, correct.
So we are in a way forced to get tempted and develop desire for the food, which you don't want actually. But still you are made to increase your appetite.
You need to control your taste buds.
Yes.
It just for taste you are eating, not to complete your stomach, fulfill you.
Once in a while, maybe we can fulfill our desires
Yeah.
and fantasies, but regular food cannot do that thing.
In moderation, you can eat anything.
Okay.
Like you can eat one pizza slice or entire pizza slice.
Yeah.
It's all up to you. So you need to eat with mindfulness.
Yeah, mindfulness and
Yes.
eat responsibly.
Responsibly.
I think soon we should be able to come out with terminologies like eat responsibly.
Yes.
Now we have it for a drink responsibly.
Yeah.
So indulge in food responsibly.
And when it comes to drink, make sure you complete your water intake throughout the day.
Exactly, you rightly said. People now, we keep seeing many of these urinary tract infections, people with dehydration. So water is very important
Water
source.
is-
At least I believe practically 2 liters to 3 liters of water is very essential.
Yes,
See, typically in Indian climate, because we sweat, we drink a lot of water.
a lot of water.
But since majority of our workforce now is working inside the air conditioners,
Yes.
so thirst might not as such develop because of your sweat. So you should again consciously remember to drink the
Yes.
appropriate amount of water that is required for you.
Yes. For that, what we can do, you need to get up in each hour.
Each hour.
Just walk and drink half of glass of water, your full glass of water,
Yeah.
as per your thirst. But
Okay.
you need to get up in each hour, so you'll physically active also
Yeah.
in your office, in
Yeah.
your workspace.
Yeah.
It will take care of your hydration part.
And also sometimes we are seeing people, you know, popping up these vitamin pills, expecting miracles to happen. As a doctor, I wouldn't really encourage them to buy whatever, you know, they find it attracting them to eat. So I think these vitamins should also be taken very cautiously, and some kinds of health supplements also that are being extensively promoted in many of these across pharmacies.
Yes.
And they end up, you know, buying so-called healthy foods, but then again still they land up with the doctor with their elevated triglycerides, elevated uric acid levels, elevated blood glucose levels, and blood pressure. Our talk wouldn't be finishing without mentioning the blood
BP,
pressure, you know. See, definitely we doctors give blood pressure lowering medicines, you know, typically when they are above the age of 50 and where the blood pressure systolic is more than 140 at more than 3 occasions. But the problem is now youngsters are developing hypertension. You know, if it is related to any of the organs, say heart or kidney, or if it is any, you know, hypertension that has to be definitely controlled with medications, yes, we are here to help you.
Yes.
But majority of the times nowadays, it's because kind of a stress induced high sodium intake, and because of the weight, lack of sleep, and
Stress level there.
yeah, and kind of happiness, you know.
Yes.
Happiness naturally I'm meaning. It's not that you achieve happiness, you should be happy with what we have today.
Yes.
We may have goals, you want to, you know, escalate in your life with certain aspects, but every minute you can't be thinking about your aims and goals. You have to be contentful, feel happy for whatever we have achieved so far, and I believe that also will help us to somewhat controlling our hormones and not pushing our body to the extremes. So what do you say about these salt intakes?
Salt intake is good for your health.
We need.
What we are doing, we are eating junk. We are don't know what they put in that food. So that's the basic cause of your stress level, your hormone imbalance. You are eating daily outside. You are eating outside just thela. You don't know what oil they are putting in that. Hygiene maintain, they are maintaining it or not. So lots of factor. You just need to be take care of your decision, and doctor and fitness and nutrition consultant will only guide you what you have to do, but final decision yours. You want to take it or not, for how much time you will follow that.
See, salt is purposefully added to elevate the taste buds, to develop a craving, and it also prevents the satiety. See, our actually Indian foods, when you eat certain amount of food, you feel enough. I'm full. Baba mere ko mat do, bas mera pet bhar gaya hai. That is called satiety. But these foods, when they are high in salt, high in oil, and kind of taste, they kill our satiety and they force you to eat more. Craving is more. So here, definitely, when we spoke about salt, there is a limit. Essentially, a normal healthy person should not take more than 5 grams of salt.
Yes.
Keeping in mind that he is having good physical activity and stuff. But if a person really wants to lower some weight, if a person is having hypertension, if a person is having any other concomitant conditions like any heart condition or kidney condition, then the salt required to be taken per day is even less than 3 grams. The nephrologist advises typically, if there is a CKD, less than 3 grams restricted salt.
Yep.
And cardiologist also advises you to take less than 5 grams, but more precisely it's up to 3 grams. So typically we should restrict our salt intake within 5 grams. So if the salt can be reduced, then the need of the blood pressure medications is going down. That's what I have observed in my practice. People who are on 2 tablets, they can come back to 1 tablet. People who are on 3 tablets, they can come to 2 tablets. And sometimes some people who are on 1 tablet, their dose can be reduced, or even it can be stopped at certain point of time with the doctor advice. And people who are on borderline hypertension, say systolic of 130 to 140, 150, it is fluctuating. and if you are able to reduce your overweight and do the salt restriction, their systolic blood pressure is coming within the normal. So then they might not want to have their doctor might not want to then prescribe a tablet then.
Yes.
So like that, there are many ways of consciously being trying to be in good health.
Yes.
Thank you, Tinkesh.
My pleasure, sir.
We will definitely continue this episode in the next occasion.
Sure.
I believe we briefly discussed about our views.
Yes.
Thank you.
Thank you for having me.
So thank you, Tinkesh.
Thank you, sir.
And this is Dr. Kiran signing off for today. Have a good day all.